I don't think people in other places of the world also understand that you just can't go to a CVS or Walgreens here and get
Right.
vaccinated.
Hello, Jessica.
Hi,
What's
Peter.
what's happening? What's going on today? Today, 4 years after you first heard about COVID.
Life is calmer for sure.
All right.
I'll say that.
All right. What were you doing where were you what were you doing when you first heard this COVID thing?
Um, so we are in Mexico. My husband and I are in Mexico, and I was here. My husband was actually in New York City when we first heard about it. And when things started getting bad in New York, my husband was in New York. And so I was here in San Miguel, just living semi-retired life, enjoying myself. And then we heard what was starting to happen around the world.
Right. And you were when you say semi-retired, what were you doing before you quote retired unquote?
I'm a nurse. I worked in critical care.
Okay.
I worked in infectious disease response teams in the United States.
All right. So you were kind of set up. So all right. So COVID hits.
Mhm.
In degrees. Certainly, March 2020 was the key thing. What did you do to help everybody get through this using your skill set?
Well, for me, um, I tend to be able to process things when I understand them. And so when this began to happen around the world, and it was so much of an unknown, it was something brand new. It was something that the most skilled, educated professionals in the world had no idea what they were dealing with. So I began speaking with some different women, and they were all women here in San Miguel of different professions. Some were nurse practitioners, some were infectious disease specialists, some were PhDs in different types of areas and worked in AIDS in Africa. And we began to discuss what we could do here for the community. And we started doing different types of research and putting together different types of ideas to see what we could understand and how we could make that work within our community here in San Miguel.
Okay. And what did the community need? I'm going to use San Miguel as a sort of a baseline for every people in Kansas having the same issues and questions.
Okay. Oh,
What did people need to know at the it sort of if you could say sort of at the beginning and then the middle? How did things shift?
so I think at the beginning, there was such a fear based for everybody around the world because of the total and complete unknown. Nobody knew how contagious this thing was. Nobody knew how deadly it was. Everything we were getting were, a lot of worst case scenario reports. The healthcare systems weren't ready. We just nowhere in the world was prepared. So there was so much fear, I think, in around the entire world, whether you were here, whether you were in, the most advanced country in the world. So we started a an informational page here, and we began putting together information. We began researching best practices, whether it had to do with masking, whether it had to do with infectious disease, as far as like droplet precautions, whether it was contact precautions. And these are different types of precautions that the virus itself was classified at different times. I don't know if you remember that at the beginning, they thought it was carried more by a cough and the sputum that was
Right.
dropping around. And then as time went on, they learned more about it being airborne. And so we did lots and lots of research, shared a lot of information, lots of questions and answers at any given time. We put together home care guides. We began a mask project. We, provided probably 300,000 masks to our community here. We worked when it came down to the point of vaccination campaigns of getting people from outer communities to become in. As I think time progressed, I think San Miguel became a little bit different in a few aspects, in that this is a very small town, and we don't have major hospital systems, major healthcare, major anything within the city. So I think probably more here than a lot of places in the world, lockdown maybe looked different than in some other places because of the resources that weren't available. So here, the mindset was we just don't want to get it. And that was because as the pandemic progressed, maybe if you were in New York City or California, they had state of the art equipment, doctors, they had staffing. We didn't have that here. And so the prospect of even becoming sick was a really big prospect, and a very scary prospect for a lot of people.
Well, so when people, let's just cut to that chase. When people did
Okay.
get sick, did they have to go to Querétaro, which is a town an hour away, or down to Mexico City? I mean,
So
if
so
somebody
sometimes that
really got sick? What happened to them?
so depending upon this is a good question. Depending upon who you were and what type of the healthcare system in Mexico is also very different. It's socialized medicine here in Mexico. So if you're a Mexican citizen, you're either going to one of two systems, and both are run by socialized medicine. So one of the systems, we don't even have a single intensive care bed or an emergency bed here in the city. So those people, if they had room, were transported 2, 3, 4 hours away, sometimes even more, just depending on if they had room. So what that meant is that a lot of people were very, 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 very sick and being taken care of at home.
Right,
If you are somebody that had private insurance, you had the option. I think here in San Miguel, we had 4 ICU beds. And we have one ICU doctor here in San Miguel. So even if you were very, very sick here in San Miguel, very often you were transferred to another city where they had rooms.
right,
But again, more often than not, you were being taken care of at home. There were times where we didn't have enough oxygen equipment for people at home and they were suffocating at home. We couldn't get the medications we needed to help people get what they needed at home. So, whereas I don't think things like this were happening in more advanced countries where they have more of an infrastructure in place. Those were the type of things that we were facing here as the pandemic progressed. And as we have learned, there are peaks, there's waves of this pandemic, and sometimes things were calm and fine, and then sometimes,
right.
things were out of control.
And how many, so you work pretty hard on this information. Um, how many hours a day and for how long was your guidance, I'll call it intense? I mean, a lot of incoming and a lot of outgoing information from you and your team.
I would say almost 2 years,
Okay.
between different, and again, and I think like through that 2 years, it really shifted a lot. At beginning, it was information. There were times when we were really busy triaging. There were times when we were busy when vaccinations happened. I don't think people in other places of the world also understand that you just can't go to a CVS or Walgreens here and get
Right,
vaccinated. They
right.
did them with brigades. So they would come to our town for 2 days, and they'd start with an age group, and people would line up for 8, 10 hours a day. People would carry in their 70-year-old, grandmother or grandfather just to get them vaccinated. So I think through the pandemic, a lot of that shifted about
Mhm.
where we were focusing our time.
And you did, your outreach was both in English and Spanish?
Both.
Okay.
Both.
What freaked people out? I mean, if I don't want to go back into my head right now, but um, uh, was it part uncertainty, second part, where do I get the masks that I need? I mean, do I actually have to wipe down my groceries? I mean, what were some of what were like the five questions that you probably got over and over again?
We did. We got questions over and over again. And I would separate them maybe into a couple of different things. And again, depending on the time. But for sure, at the beginning, a lot about masks and do I wash my vegetables, how to wash my hands, what do I do about going into places? is this quality mask? So just a lot of information about physical barriers and how to protect themselves. Um, we got a lot of questions when people got sick, and that was kind of a different, and that was for us probably one of the most difficult times. I'll tell you a story about somebody that I know that stayed very, very safe for always during the pandemic, but didn't see grandchildren. So they, husband, wife, her parents all living together, didn't see grandchildren, didn't have any help in the house. One of the parents was handicapped. So very, very difficult for a long period of time. And the family ended up getting COVID, and this was before vaccines, all
Hmm.
four, and she lost three of her family members.
Wow.
It was, and they all died at home. It was a
And
time where we didn't have room in any of the hospitals here. We didn't have access to the type of equipment they needed. So I remember a point being on the phone with them and the doctors instructing them to use insulin inside of their veins to bring down part of the medical condition, which as a critical care nurse, as somebody that worked in critical care, if I had a patient like that, I would have been one-on-one with that patient with state of the art
hmm.
equipment and testing things to be able to even attempt that. And these are the kind of things that people were doing at home.
Right.
So we would get those questions. We'd get the really hard ones of where to go. People panicking. Is there a doctor that can come see me? Where can I get oxygen? Here, they don't tend to have the concentrators that are used like in the US. They use the bottles that last for a couple of hours. So even being able to get their hands on oxygen bottles that last more than 2 hours. So we got those type of questions a lot. Um, Symptom management, a lot of symptom management type questions. People with high fevers, people with breathing, obviously with oxygen, and how to best try and manage some of that at home. Um, we got lots of questions when it came time to vaccines. Lots of questions about people just wondering where they could go get them, not necessarily understanding the brigade. We spent, when a brigade was here, we were on the computers and in the community, all day, all night, just updating where to go, how to get there, transporting people from other communities in. Um, so just real grassroots, hands-on type
Sure.
type questions about what was going on.
Sure. Well, I'm gonna
Mhm,
I'm gonna end this with a strange question. Very, it's
mhm.
about me.
Okay,
You know me. So,
I know you.
um, my microphone. Okay, here's the question. I never got COVID. I've been vaccinated. I actually went up to Texas twice to get vaccinated, which is a fun car trip from Mexico. And then I got one shot here.
Mhm.
Everybody around me has had COVID. I mean, 90% of the people. I never got it. I guess, do a little of that. Um, why would someone not get COVID?
Um, so I think, okay, so I think that's a twofold. I think there's different answers that are possible for that. Part of it may be that you had COVID and you may have been one of the people that were asymptomatic. So it's possible that
Okay.
you have had it. But there's also some talk. There's still a lot unknown about this virus and this disease and how rapidly changing it is. There's some scientists that believe that there is some makeup within certain individuals that make them their immune systems just different, or
Hmm.
more immune to the disease. So I don't know that people know that yet.
Do
I
you
don't
think
know
that?
that you lived in a bubble. I don't think you lived in a bubble and didn't go out and just totally what were you abstained from everything. So I don't think that's the answer.
No, I went out. I mean, I did reasonable things. I didn't do unreasonable things, but I also, got out of the house. So, I don't really want to show you my bicep here, but I attribute it to just being a
Pure strength.
pure strength. Okay, last question. Um, did all of this change you? And if it did, how? As you as a person?
I absolutely know it did. And it's even been an evolution over the last year of kind of figuring that out. Part of me, what I think how it's changed me is I have much more appreciation about doing the things I want to do because I want to do them, and much more appreciation about
Hmm.
being reasonable, being rational, being not a panicker, not
Right.
uh, uh, not giving in, I think, to a lot of what societal expectations are. And I think a lot of that has to do with lockdown, about choices about who you potted with, about what you said yes to, what you said no to. And I also think the experience that we had here with COVID itself, and learning more about, boundaries, and the rational side of not having to freak out, managing so much information, and so much information for a city of people being afraid, was really a job, I think, of being reasonable.
Yeah.
um, and I had a lot of practice at
Okay.
it.
So, all right. So the last one I heard, which I'll key on for the end of this
Okay.
interview, is that you're well, let's just say you're more focused, more aware. The sort of be here now kind of concept of being aware of the moment, because our heads were so scattered. Would that be a good way to represent your mindset today?
I think so. And I think, and again, like I said, I think I'm much better at boundaries of what's healthy and what's not healthy.
Okay.
Um, it- okay. Yeah.
Well, then we'll drink some tequila later, and because
Yeah.
we understand that boundary, or that is within the boundaries.
That's within
Uh,
it.
all right, Jessica, thank you very much. I appreciate it.
Mhm. Thanks, Peter.